Welcome back. Despite advances in treatment, 1 in 5 patients will progress to heart failure with subsequent worsening, and patients are at increased risk of repeated hospitalizations. Even for the 1 in 10 patients coping with these extreme heart failure, the condition can still be reversed for some. In this video, we explore the various devices and procedures that can effectively treat severe heart failure. These devices are used in situations where medical therapy alone is not enough to achieve the desired control. In our previous videos, we talked about cardiac remodeling and the 4 main pillars of the pharmacological treatment of heart failure. If you are interested, you can go back and watch these videos in our channel. Number 1. Ventricular Assist Devices, VAD. A ventricular assist device is a mechanical pump designed to support heart function and maintain blood flow in a weakened or failing heart. Surgically implanted in the body, it works by pumping blood from the lower chambers of the heart to other parts of the body. A VAD can serve as temporary support while awaiting other treatments, such as a heart transplant. In some cases, it serves as a permanent solution to help the heart pump blood. Typically, there are 3 situations in which a left ventricular assist device, LVAD, may be recommended by your healthcare provider. Initially, if you're waiting for a heart transplant, an LVAD may be used temporarily until a suitable donor heart is found. This is called bridge to transplant. Despite the damage to your heart, an LVAD can keep blood circulating throughout your body. Once you receive your new heart, the LVAD will be removed. In addition, an LVAD can improve the function of other organs while you wait for a transplant. It can also relieve high pulmonary pressures that may otherwise prevent you from being considered for a heart transplant. Another scenario is if you're ineligible for a heart transplant because of age or other health issues. In cases where a heart transplant isn't an option, an LVAD can serve as a permanent solution. This use of a ventricular assist device is called destination therapy. It can improve the quality of life for people with heart failure. Finally, if you're experiencing temporary heart failure, your cardiologist may recommend the use of an LVAD until your heart regains the ability to pump blood on its own. This approach is called bridge to recovery. To determine if an LVAD is appropriate for your condition and to select the most appropriate device, your cardiologist will consider several factors, including the severity of your heart failure, any other significant medical conditions you may have, the function of your heart's main pumping chambers, your ability to safely take blood thinners, the amount of social support you have from family and friends, your mental health and ability to care for a VAD. Number 2. Heart reconstruction procedure. The electrical impulses responsible for heart contractions typically move in a spiral pattern. Ideally, the heart resembles an elliptical shape, similar to a football, which makes it easier to receive the electrical signals that initiate heartbeats. However, in heart failure, the heart often enlarges and takes on a spherical shape similar to a basketball. This altered shape disrupts the heart's alignment with the electrical pattern, reducing the efficiency of the system. Various surgical procedures are available to reconstruct the heart and restore its optimal shape. You and your doctor can explore these options to determine the best course of action for you. Another situation that may require a heart reconstruction procedure is when a heart attack occurs in the left lower chamber, left ventricle. This event leads to the formation of scar tissue that, over time, can weaken and thin, forming an aneurysm, an abnormal bulge of tissue. This aneurysm, along with other heart problems, can cause the heart to enlarge, impairing its ability to pump blood effectively and leading to heart failure. During ventricular reconstruction surgery, surgeons remove part of the scar tissue from the aneurysm to reshape the heart and restore its normal conical shape. Typically, a small patch is sewn into place where the aneurysm used to be. Once the patch is in place, surgeons stitch tissue over it. Other procedures, such as valve repair or coronary artery bypass grafting, may also be performed during ventricular reconstruction. Ventricular reconstruction does not cure heart failure. The goal of the surgery is to enhance the heart's ability to pump blood effectively, thereby reducing chest pain, shortness of breath, and other symptoms associated with heart failure. Before the advent of ventricular reconstruction surgery, heart transplantation was the only option for patients with large left ventricular aneurysms. Number 3. Heart transplant. A heart transplant involves the surgical removal of a diseased heart and replacing it with a healthy heart from a donor. You may need a heart transplant if your heart is failing and other treatments have proven ineffective. End-stage heart failure is the most severe form of heart failure, in which the heart muscle is significantly weakened and unable to effectively pump blood throughout the body. At this point, other treatments are no longer effective. After a transplant, your body's immune system may reject the new heart. Rejection is a normal reaction to foreign tissue. When you receive a new heart, your immune system sees it as a threat and attacks the organ. To prevent this from happening, you will need to take anti-rejection medications, which trick the immune system into accepting the transplanted organ and preventing it from attacking. You will need to take these medications for the rest of your life to prevent or treat rejection. These medications can have side effects that vary depending on the specific medications you are taking. Regardless of whether a full recovery is possible, almost all heart failure patients require ongoing medication and regular follow-up visits with a cardiologist. Effective therapy addresses both your symptoms and the heart problem itself. By treating the underlying problem, you increase your chances of a full recovery. Alright, this video covers the surgical treatment options for reversing heart failure. For more details, such as how to reverse heart failure with medication, please watch our previous videos in The Healthiest. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.